there are estimated 50 million people in the United States that suffer from allergies. And of course, this time of year, with things blooming, allergies are really bad. Excuse me just one second. Okay, now, our guest today is Dr. Cary Finn. Dr. Finn is with Finn and Associates, and we're really glad to have you today.
Thank you.
All right, Dr. Finn, this is the time of year of allergies. Everybody's sneezing and sniffling. There's pollen on everything. Everything's turning green. So patients are starting to come in complaining of coughing and sneezing. What's your approach to allergies this time of year?
Well, this is a very prevalent time for allergies. You'll hear doctors call it an allergic rhinitis. So the symptoms you'll see are runny nose, nasal congestion. People will complain of fatigue. Their ears and mouth will itching the top of their mouth. So the first thing you want to do is try to do something about the allergic part of it all. Try to get them to avoid any allergens when they cut grass, have them wear a mask, and then usually I'll start with an antihistamine as my first pill type treatment.
Now, oftentimes the question is raised, do I have an allergy, or is this a cold, or do I have a sinus infection? What are some of the ways that you differentiate between that?
Well, with allergies, the differences with sinuses, usually you'll have some facial tenderness. Your top of your teeth will be tender. The difference is you'll have clear runny nose with allergies. It'll be more purulent or have color when it's with sinuses. Fever can happen with sinuses. You won't get that with allergies.
So when should patients come in to see the doctor? If they're having symptoms and they've taken some of the over-the-counter medicines, how long should they really go before they come in and see what's going on?
So to have allergies for up to a week is not that bad. It depends on their symptoms being so severe that they feel like they'll need further treatment. The problem is with both allergies and sinuses, more times than not, it's viral and an etiology, or that's the cause. But if the symptoms go on over a week and fatigue and such keep you out of work, that's a good time to come.
You touched on this a little bit, but tell us, what are some of the things, I've come in to see you, I've got allergies, you've put me on some medication, but what are some of the things that I can do around the house or at my work to try to keep these symptoms to a minimum?
So avoiding what's causing the allergies, such as when you cut grass, wear a mask.
Well, what about allergy tests?
Testing.
Is that something that really, in my experience when I do them, it seems like they're either allergic to nothing or allergic to everything?
Yeah, a lot of times when I send them to the allergist, they'll do the skin testing, which at times can help. If they have the kind of stuff that having routine shots will help, but that's more for annual or people that have allergies throughout the year rather than seasonal.
Well, there are so many different over-the-counter medications right now, and there's some that I know that can interfere with prescription medicines as well. What are some of the cautions or concerns that you tell patients about using a lot of over-the-counter medicines to treat their allergy symptoms?
Well, the most common thing is that if they have a decongestant, that the blood pressure needs to be monitored closely. There's a lot of the nasal sprays and some of that you use for wheezing that have actually been taken off the market because they're so strong that they cause blood pressure problems.
Now, recently they just approved one of the steroid sprays over the counter.
That's correct.
Do you ever recommend that to patients as well?
The nasal steroid sprays are excellent. They're easy to get off of versus the Afrin and other types of those type of medications. If you do them, but you have to stay with them. They don't work in a week or so. It's something that you have to stay with for,
It doesn't give you the symptom relief like you said Afrin does, so people have to be patient with it a little bit as well.
Have to be very patient, but in the long run, they're the safest and probably most reliable.
All right. Well, just an extra word to what Dr. Finn said. Be extremely careful with over-the-counter medicines and make sure you check with your doctor to make sure you can take over-the-counter allergy medicines with your prescription medicines. Now, coming up, we're going to have a subject that we're going to discuss that 20 million Americans all suffer from. So you want to stay tuned for that.